Tensions are rising in Zimbabwe following the arrest of 50 nurses at Marondera Hospital during a picket action. There are now growing calls for their immediate release, with healthcare workers across the country threatening to stage an hour-long picket within the next 72 hours if their colleagues are not freed. The situation has also revived memories of 2018, when the government dismissed more than 10,000 nurses who were protesting for better wages. Now, to unpack these developments, we are joined on the line by democracy and political activist General Sithole. General Sithole, good afternoon, and how are you today?
Good afternoon, Tracey. How are you?
Very well, very well. So what is your understanding of the circumstances surrounding the arrest of these 50 nurses? And do you believe their arrest was lawful, or does it violate their right to protest?
Thank you so much, Tracey. All we understand is that the arrest was not lawful because of the authenticity of the grievances which were being put forward by the nurses. Reason why we are saying it is unlawful, this is not the first time we have the nurses, especially the healthcare workers, bringing forward their grievances. We have got a trace of 2018, which actually resulted in people being dismissed from work. These are the new recruits, most of them. And if you can check from 2018 up until now, we are still having another cycle of demonstration grieving for the very same grievance. So we are actually not going to say there is unlawful in their protest. The arrest was unlawful because the grievance is authentic and it is known from long back. The fact that the government did not attend to it for the first time they started this, it shows that they are not willing.
So what does this incident say about the state of workers' rights, particularly in the health sector in Zimbabwe? And are healthcare workers being unfairly targeted for speaking out?
Exactly. That is 100%. Because if we do have the government which does not want to respond to the grievances, but rather respond by sending the police to go and arrest the people who are together discussing of their grievances, then it shows that their democratic space is closed. This is a clear indication that the government is ready to silence all the dissenting voices. And the nurses, they were not demonstrating. They were picketing inside their premises. And for your own information, Tracy, this is not one hospital. We were going to understand if it was one hospital, but we have got over 7 different hospitals in different provinces, which shows that we've got a crisis in the health sector. Amongst the crises, we can see the spirit of patriotism in them, because it is clear and indicated on the public domain that the working conditions of these health workers are not conducive. They are not working with the proper PPE. They don't have medicine. They still have to liaise with the relatives to actually go and get some of the stuff which were supposed to be seen in the hospital from the private pharmacies. But in all these conditions, we still have the nurses who are coming to work. Now they come forward to cry that, please, giving us $250 is not enough, especially looking forward on the hike of the petrol. Obviously, the transportation money from work to home to work, it's no longer adequate. Then having a government coming down to arrest the people, then it doesn't mean anything.
So there's threats of nationwide pickets. How serious is the risk of escalation? And what impact could this have on an already strained healthcare system?
Picketing is going to go on, and it is very serious. Because as long the grievances which is triggering this picketing is not attended to, just as I was addressing last time, to say they need to go and engage them, see how they can meet these people halfway. to resolve their grievance. As long as the government is going to use the security force to silence the people who are bringing forward the authentic problems which they are having, then we have to expect a lot. And this is going to give a direct disadvantage, mostly to the patients who are looking forward to have the attendance, because already the government has shown that it has got nothing to do with the patients. The reason why, when I was speaking with these nurses, the reason why they were doing the 30-minute picketing during their working hours, it is because they wanted to go back and attend the people. So now it's going to be another issue, because we are having a government with regards to send the police to go and take people from the premises of their work, go and put them in the jail. Then which shows they don't care about the patients, because these people were on duty and they were planning to do a timely picketing to send forward a message, then go back to work. This is very serious, and we really need to actually call for the government of Zimbabwe to reconsider their action before they do anything.
And just on a final note, so Zimbabwe has also reported that 15 of its citizens have been killed fighting for Russia in Ukraine. What do you know about this?
It is true. We have got a massive unemployment rate, which is actually hitting especially the young generation. We have got a young boy, I think he was 21, who is reported amongst those who lost their lives. Why? The people are now taking option to go and join the forces in Russia as a form of employment, because there is nothing to offer to the young generation, which is actually contributing to the brain drain which is taking place in the country. Massive externalization of citizens because of poverty, So this calls back to the government of Zimbabwe that instead of using the security force to win arguments, they need now to start and resort back to the point where they come and consider that in each and every problems which are there and the arguments, they need to win back the people so that we can start building our nation going forward. This is a crisis which is in the country.
General Sithole, thank you so much for your time.
Thank you so much, Tracey. Thank you.
That was democracy and political activist General Sithole.
Ritmos e cultura.